everybody, it's me, Emma. This is my 37-week update, and sorry it's been so long since I made an update. I think my last update I was 33 weeks, 34 weeks, I don't know. But I do know it's been a long time. Not much has happened since then. Actually a little bit. Of course my son wakes up now that I'm actually making the video, but he can wait. Originally I had started out being seen by my OBGYN, Dr. Dinesen, who delivered my daughter and my son. And he's a really good doctor and no problems with him. But he's really busy and he's got a very busy practice, and with that goes busy, unattentive nurses and staff. And I guess at like my 35 week checkup, I had a physician that was incredibly unattentive and just really bad bedside manner, and then outside of the hospital I heard some bad stories about her, and I don't know, not that she would be like in my delivery room or whatever, it's just not acceptable. Like, I don't find it to be acceptable as far as, you know, being part of my care. Whatever. So I went with a midwife, and I called the midwifery in the area, and they actually use Doylestown Hospital, so they're kind of working under Dr. Dinesen, to see if they would take me. I called them to see if they would take me at 36 weeks, and they said yes they would, as long as it's okay with Dinesen. But I have a heart condition, so I was a little concerned that he wouldn't allow me to switch over to the midwives, but he did. So now I'm being seen by the midwifery, and they're really nice there. It's totally different experience, you know, instead of like going into a hospital and, you know, just that kind of hospital atmosphere. It was not, their office was not in the hospital, it was in the center of town, and you know, the examining table or whatever, the stirrups had like pot holders on them instead of like, you know, it was more of like a homey atmosphere or whatever, which was cool. So that should be interesting. We'll see how that goes. Hopefully I have an uncomplicated pregnancy or labor and delivery, and everything goes well, and well, that's it really. The head midwife may not be the one delivering my baby, but she just hired somebody else, and she's new, and I met her, and she seems really young, but I'm sure she knows what she's doing. I don't know. But I think it'll be fine, because I'm, you know, even if for some reason she didn't know what she was doing, which I doubt, she's, you know, we're in the hospital, and Dinesen will be on the same floor, so I'll be taken care of no matter what. Symptoms for the past few weeks, I've just been really uncomfortable, as always. My mood has changed quite a bit within the past week, maybe 2 weeks I could even say, to a better attitude, and I think it helps that, I think it's because I'm in the home stretch. I had a lot of rib pain, which was causing me major discomfort every minute of every day. and I don't know, maybe the baby dropped or something, or my ribs got used to the pressure or something, but my ribs don't hurt nearly as much. They still do a little bit. Now it's, my only complaints are headaches, like every other day. But it really is not nearly as bad. Like, I can take a couple Tylenol and it will subside, but it's really not as bad as that all-day rib pain. Baby's moving around a lot, head down position. Sometimes the butt, like, sticks straight out, and I kind of feel like you know, in the movie Aliens, to push feet back in and reposition. I'm actually, like, repositioning the baby for my comfort, which is weird. Had a lot of Braxton Hicks contractions, like, they just really picked up within the past week and a half, 2 weeks, which is awesome because it's just a sign of things moving along the way they should be. Sometimes they're really uncomfortable, sometimes they're really rhythmic, like there's a pattern, you know, and, you know, that's why people go in early a lot of the time, because they're like, well, they're every 5 minutes or whatever. But that's what happens to me. They're really rhythmic, and you know, this is my 3rd time around. I guess I could say that I know what real labor feels like. It's really hard to distinguish, you know, false labor from early real labor, because it does really just feel like Braxton Hicks contractions. But at this point, I kind of know. With my last 2, Ella and Obi, I lost my mucus plug, like, within 24 hours before labor started, and I'm just assuming that that's going to happen again. In fact, I'd be really surprised if it didn't. Like with Obi, I noticed a lot of, you know, I was losing, like, bits and pieces of it 2 weeks prior to giving birth, and it was only ever just a little bit, and then the day before I had him, I lost a lot in the shower, and then the day, like an hour before, I lost the rest of it, and I'm talking like a handful. It was disgusting. TMI. But anyway, so I'm ready to not be pregnant anymore. Major nesting happening in this household. Just like reorganizing everything, and I'm just going with it because I'm not gonna have time afterward, and I really want, like, I have this major urge to get things in order before the baby comes. And my husband's been really helpful and kind of doing all of it. I don't know, we work together, but there's only so many things I can do. So yeah. The thing that made me think about making this video was, I was sitting down and just thinking about how much space this baby actually takes up. I'll do a belly shot before I run out of time, and whatever. I was thinking about how much space that this baby actually takes up, and you can't sit normally, or like constantly, you can't lean over it. There's only so much you can do. And I was remembering what it felt like directly after having Ella and Obi, that feeling of like, oh my gosh, I can bend over, this is awesome. We do have a name picked out, but I'm not going to share it yet. I'll wait, I'll introduce you to him with his name. Unless I already told you, I don't know, whatever. But that's it. Maybe I'll make another update later. Thanks for watching. Sorry it's been such a long time. Everything's been hectic. I hope everybody's happy and healthy and doing well. Bye!